Hello, and welcome to the Dental Learning Center. We've got a special treat for our viewers today. Dr. Buster Bedcheck will describe the preparation, instrumentation, and sequencing for a posterior restoration. Join me in welcoming today the world-renowned the Dr. Buster Bedcheck.
Good to be with you, Marie. You know, I spend all of my time now getting these people at work to fly right.
How'd they ever manage without ya?
It's all about Buster, Marie.
Our patient today needs an aesthetic crown on a lower premolar. We've got correctly mounted diagnostic casts and radiographs. We've explained the procedure to the patient, provided treatment alternatives and obtained informed consent.
We've also carefully recorded the patient's medical and dental history, and determined that no conditions exist contraindicating routine dental care.
Buster, we're looking at a lower second premolar. Will you walk us through preparing this tooth?
Sure, Marie, and most of the procedure applies to any tooth, although there may be a few differences based on the material used to construct the crown. Well, first let's verify that our plastic matrix fits, you know, the one we'll use to make our provisional restoration, and then I'll use putty to make a quick reduction guide. We'll start with depth cuts on the occlusal surface. After smoothing and finishing, the occlusal reduction should not exceed 2 mm. I recommend beginning on the mesial surface of the buccal cusp. Verify the reduction, then complete the distobuccal. After you have successfully reduced the buccal cusp, reduce the lingual in a similar manner. The 6856-016 burr works well for a premolar. The 018 is used on a molar. The tooth is reduced anatomically, so that the outline form mirrors the original tooth. Next, holding the 6856-016 burr parallel to the long axis of the tooth, we'll reduce the cervical 2/3 of the facial surface. Starting with depth grooves, we'll remove about 1.2 mm of tooth structure. We'll extend the reduction as far into the proximal space as possible. We'll produce a wide chamfer finish line. The precise design depends on the nature of the restorative material we'll be using. I would recommend reducing 1/2 the tooth, evaluate the reduction, then proceed to reduce the remainder of the buccal surface. We'll be careful not to create a J-shaped or lip finish line. If we do, we'll remove it with a K-typer.
Buster, is it essential to follow this sequence?
No, I think an experienced operator could vary this sequence, but better results come from a consistent approach. For the beginning student, guidelines are helpful in assimilating the steps.
Okay, now what?
Let's access the interproximal space with a flame-shaped burr, being careful not to damage the adjacent tooth. Occasionally, it's advantageous to recontour these adjacent teeth, particularly in cases of teeth with existing restorations. After we've opened up the contacts, let's go back to our 6856 burr to get the correct taper and extend our wide chamfer. It's important that the finish line be smooth and continuous. I like to use multiple repetitions of the burr, with light pressure.
In other words, let the burr do the work.
That's right. Let the burr do the work. Copious water spray. And of course, this is where it counts to have a good chairside assistant. Be sure to round all the sharp line angles. You can do this later, just don't forget. Okay, now let's reduce the lingual aspect. Again, hold the burr perpendicular to the long axis of the tooth, and create depth cuts. The total reduction of the lingual should be 1 mm after finishing. For the PFM with metal lingual, a narrow chamfer of about 1/2 mm is used. Damage to the soft tissue may be limited by keeping the margins supragingival. A retraction cord without hemostatic agent may be placed to provide better access to the tooth. Restorations that use a color material with veneering porcelain require more reduction. Reduction of the functional cusp requires a little bit more reduction. In the case of the mandibular tooth, the buccal cusp is beveled. So the reduction of the buccal cusp is essentially two-planar, with a cervical 2/3 reduction, and an occlusal 1/3 reduction. This bevel is parallel to the opposing cusp. You gotta be careful here. It's possible to over-reduce the tooth, losing the correct taper and wall height.
So, is that it?
No. I really like going over my preparation with a fine diamond finishing burr, I want to round all line angles, make all the finish lines continuous and smooth.
So, what about retention?
If we make a conscious effort to hold the burr correctly, we should have a total convergence of about 6 degrees. Sometimes unwanted undercuts may be blocked out on our die. Wall height should be as noted on the slide.
I don't know about you, Buster, but in the world I live in, the tooth never meets these requirements. What can I do?
I hear that a lot. Well, you can enhance retention with boxes and grooves, crown lengthening, or the placement of subgingival finish lines. It complicates things, but if the crown has no retention, one has to rely on cement to retain the crown.
You know, Buster, the most common complaint I hear from the laboratory is inadequate tooth reduction.
That's right, Marie. Insufficient reduction is a biggie. We get wrapped up in what we're doing and don't spend adequate time to verify our reduction.
Yes, Buster. But I know that's never happened to you. Well, from the Dental Learning Center, this is Dr. Marie Huggy, thanking you for joining us. For the interested viewer, other videos from the Dental Learning Center and world-famous theater are available.